Welcome to This Week in Health IT News, where we look at as many stories as we can in 20 minutes or less that are going to impact health IT. It's Tuesday, Newsday, and here's what we have on tap. President Trump signs executive order requiring hospitals and insurers to reveal their negotiated prices. We take a look at virtual reality in the operating room. We also will take a look at Vanderbilt University expanding beyond the four walls and creating a public health informatics center for the community, as well as Newark Presbyterian gets a large gift to start an Institute for Health Innovation. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health leaders. This podcast is brought to you by Health Lyrics. Every health system needs to do more with less. We know where to look. Let's talk. Visit healthlyrics.com to schedule your free consultation. Want to support the fastest growing podcast in the health IT space? Here are 5 easy ways you can do that. 1, share it with a peer. 2, follow our social media accounts, LinkedIn, Twitter, and YouTube. Number 3, interact and repost our social media content. That would be great. Number 4, send me feedback, questions, comments, recommendations. Guest recommendations is also fantastic at bill@thisweekinhealthit.com, and subscribe to our newsletter on the website. So let's get to the news. President Trump signs executive order requiring hospitals and insurers to reveal their negotiated pricing. So let's start with, let's do this story in reverse, actually. So here's what the order is about. The order instructs the Department of Health and Human Services to issue a proposed regulation within 60 days requiring hospitals and to publicly post standard charge information, including charges and information based on negotiated rates, and for common or shoppable items and services in an easy-to-understand, consumer-friendly, and machine-readable format. In addition, the executive order requires HHS and the Departments of the Treasury and Labor to issue within 90 days an advanced notice of proposed rulemaking soliciting feedback on a proposal to require providers, insurers, and self-insured group health plans to provide or facilitate access to information about expected out-of-pocket costs for items and services to patients before they receive care. The order also instructs HHS and the Department of Veteran Affairs and Defense to create within 180 days a roadmap to align quality metrics across federal healthcare programs. It also instructs federal agencies to expand access for researchers to de-identified healthcare claims data, and federal programs to direct Treasury to issue guidance and expand the availability of health savings accounts to pay for more healthcare services. So it's a pretty overarching executive order with a lot of reach. Let's just say that. The reaction has been exactly what you think it would be. There's been an awful lot of pushback. Let's read some of these. So provider and payer groups came out against the order, saying it could affect and even raise prices. Publicly posting privately negotiated rates could in fact undermine competitive forces and of private market dynamics and result in increased prices, said American Hospital Association President and CEO Rick Pollack. Matt Iles, President and CEO of America's Health Insurance Plan, said publicly disclosing competitively negotiated proprietary rates will reduce competition and push prices higher, not lower, for consumers, patients, and taxpayers. AARP said it supported the president's efforts to create transparency and lower healthcare costs. So what on this? This is not a political show. I don't intend it to be a political show. I cover this because it is a story that's going to impact health IT. But let me just offer a couple little tidbits here. One is arguing against transparency, regardless of which side you're on, and no matter what is out there, arguing against transparency is a losing argument. It always has been. Transparency for pricing is good in a free market economy. Getting there is hard. No one is arguing that. Getting there is hard, and there will be some unintended consequences. But at the end of the day, healthcare does not function like a free market service, and there's an intention by this administration and people within this administration to make it look more and respond more to competitive pressures, and that is the attempt here. Pricing continues to go up. I sat down at a college university a couple of weeks ago, and they said, "Hey, would you like to lock in your tuition?" And I looked at it, and the tuition rate was not a lot higher, but significantly higher, 6, 7, 8% more than what the first year was. And I said, "Would you like to lock in at this higher rate?" Meaning that for my daughter's freshman year, I would actually have to pay more than I was going to pay at this lower rate. I said, "Well, why would I do that?" She said, "Well, it's going to go up 4.5% every year." I said, "Are you telling me that it is going to go up 4.5% every year from the time my daughter's a freshman until the time she's a senior?" She said, "That has been our policy, yes." And I'm like, what industries do we get away with that? If Amazon all of a sudden came out and said, "Hey, shop with us, we're great, we're fantastic, we only raise our prices 4.5% every year," you would just go somewhere else. That's what they're trying to put onto healthcare. Now, I understand it's complex, but that is just the way it is. This is an election year. This is going to be a hot button topic. You're going to hear all sorts of stories, and it's going to be very hard to determine what is right and what is wrong. We have the Medicare for All debate going on right now. We have stories from Kaiser Health News I decided not to cover, and some others on the whole Medicare for All thing. It's an election year. A lot of talk about these things. We'll continue to discuss it. What does it mean for the health systems? Health systems should be able to consolidate this data, slice and dice it in any number of ways. Your data ninjas should be really good at working with these operational metrics, and providing transparency around these metrics should not be all that hard. There's consternation around it because it's negotiated rates, and it will really reveal how people negotiate in the individual markets and how prices get to be the prices they are in those markets. I think this could be a negative for some health systems. I think it could be a positive as well. You're going to get transparency in both sides. You're going to get transparency in what you've been able to negotiate, but you're also going to be able to see what everybody else has been able to negotiate in your market. So interesting movement. Thought I'd share it with you guys. I like the next one. The next one is one of those feel-good stories. Hoag Hospital showcases the use of virtual reality in the operating room. Orange County Register Lou Ponzi shares this. Hoag Hospital in Newport Beach, right down the street from me, recently hosted a tour of its operating rooms. This was in the Orange County Register. It's really a puff piece. I mean, they essentially went in there, went through the tour, and got to see this thing. And anytime you see this stuff, you really has a wow factor to it. So you can't help but to write a story that is really excited about what's going on here. So wearing the surgical theater headset, which looks very much like the one that gamers wear. Dr. Robert Lewis, a neurosurgeon, said he can virtually implant himself in the patient's brain and travel anywhere in the brain he needs to go. The technology allows the surgeon to rehearse the complex brain and spine surgery in virtual reality multiple times if necessary before operating on a live patient. And he goes on to say, "I can do it 3 or 4 times, get comfortable with it before I actually get to the patient." Surgical theater was founded by Elan Gary and Modi Avisar, former Israeli fighter pilots, adapted the technology used in fighter simulations for the operating room, which is great to see that technology, either go from the space program or the military spending to something, just a much better application of it. So appreciate that technology moving in that direction. Jerry and Advisor began working on their projects in 2005, and the technology received FDA clearance in 2013. The technology uses existing MRI scans to create 3D models of the brain that are compatible with virtual reality. And it really is interesting. You literally can walk through, you put these goggles on, you can walk through, and it creates some interesting dynamics. You can sit down with the patient and walk through the tumor and explain to them how it's going to be removed, what it's going to be like after. And it's just a different perspective. Seeing is a lot more powerful than just talking about something or just showing them pictures. And so the wow factor is kind of interesting. The hospital has 2 operating rooms equipped with surgical theater equipment and has used it in more than 1,000 cases, which is kind of cool. Both operating rooms are also equipped with 84-inch touchscreen monitor. Think just a giant flat screen TV that allows manipulating of the image so that people who don't have the headset on can actually see it as well. Initially, virtual reality technology was used mainly for brain surgery, but now it has expanded, which is awesome. And the final quote on this is from Dr. Michael Brandt Zawitsky, who says, "We are starting to see virtual reality in healthcare expanding dramatically." Brandt Zawitsky said, It ensures shorter patient surgical times, improved outcomes, improved safety, equating to cost savings for healthcare. So what's the so what of this? One, shorter surgical times, improved outcomes, improved safety, cost savings is pretty much the holy grail. So this is pretty interesting technology. I think I'm kind of surprised that it has such limited use. It really should be taught in every medical school. The technology should be available in every medical school. I think it's a really fascinating advance in patient to physician communication, as well as the ability to practice without having to practice on humans, which I think is great. And so I'm looking forward to seeing more of this and see it advance. One of the quotes from this past week's show with Dr. Klasko, he said he's looking for people that can look out 10 years, see what's going to happen, and have the courage to do it today. And this is one of those things that is going to be very prevalent in 10 years. I'd love to see more systems figure out a way to fund and adopt this technology and start to get it more mainstream in more locations. Okay, so third story, Vanderbilt University Medical Center launches Public Health Informatics Center for healthcare. I love this story because it's about reaching beyond the four walls, which I think is going to be so important for us as we try to improve the health and quality of life of the people in our community. So, Vanderbilt University Medical Center is forming a new center for improving the public's health using informatics, CIPHI, with the aim to provide a bridge between public health and healthcare by mutually developing and testing critical informatics capabilities for improving population health. The center, which will be co-directed by Michael Matheny, I assume Dr. Michael Matheny, so not the former coach for the St. Louis Cardinals, and Melissa McFeeters, PhD, will also look to expand the needed capacity in graduate education in public health informatics, officials noted in a recent announcement. According to the university officials, CIPHI will coordinate with state and national public health agencies to offer services and expertise in developing key informatics and analytics capacity and developing new research programs and expand research faculty capacity, particularly in the areas of public health, reporting and data exchange with healthcare, integration and use of evolving data systems, real-time predictive analytics, population surveillance and risk adjustment, and medical product surveillance. It seems like the scope might be a little too big, if you ask me, but I applaud this effort. Thinking beyond the four walls is excellent. This is the so what. So thinking beyond the four walls is excellent if 80% of outcomes are not healthcare specifically related. They are social determinants. We've got to figure out how to marry these things together. And if you want to have a greater impact on the health of your community, you just have to be able to utilize this data in partnership with these entities to start to address those social determinant things. It's you've got to address the 80%, otherwise health is not going to improve. So fantastic work by Vanderbilt. The last story I'm going to take a look at also I think highlights one of the leaders in the industry. That's New York Presbyterian launches the Hauser H-A-U-S-E-R Hauser Institute for Health and Innovation, and this is from Healthcare IT News. Let's see who wrote it. Bill Sawicki. New York Presbyterian has launched the Hauser Institute for Health Innovation in recognition of the visionary philanthropy of longtime supporters Rita Hauser and Gustav Hauser. The Hausers have given more than $50 million to New York Presbyterian in support of the hospital's innovation programs in health information technology and telemedicine since 2011. The key focus of the new initiative will be expanding telemedicine services deeper into the communities New York Presbyterian serves to provide high-quality, convenient, and affordable care with an emphasis on preventative health and wellness. So Daniel Barchi, who we've had on This Week in Health IT, and I will probably circle back around with to have a discussion on this and other topics, says Hauser, investment in telemedicine is allowing New York Presbyterian to develop a fully integrated emergency care and urgent care ecosystem. This is one of the things he talked about on the show, is just expanding the use of teletechnologies, remote patient monitoring, on-demand services, putting telehealth services in the in the ambulatory, in the ambulance and the transportation services as well. So they have a lot of different areas they're looking at. Teleparamedics, that's what it is. Teleparamedics in high-risk patients, clinical operations center, remote patient monitoring, New York Presbyterian on demand. There's a lot of different areas they're looking to focus this in on. Very exciting. I can't think of anyone else I'd rather give money to than Daniel Barchi and New York Presbyterian. I think they will utilize it very well for the very large community of New York City. So excited to see where they go with that. Well, that's all for this week, holiday week. My mom's birthday. A lot of exciting things happening this week. Hope you enjoy your 4th of July holiday. This Friday, and well, actually, before I talk about this Friday, this past Friday, I did have Dr. Stephen Klasko and Nasser Nizami of Jefferson Health on the show. Huge range of topics, great quotes. The person who I have transcribed the podcast for me called me up and said, she pulls out the key quotes, and she pulled out a bunch of the quotes, and she goes, there's too many good quotes. So that's from somebody who's not necessarily in healthcare saying, they said so many amazing things, and I'm going to keep coming back to some of those topics. So if you get a chance, check that out. Wonderful conversation. You can check it out on thisweekhealth.com. This Friday, we're going to be talking security, so you'll want to check that out as well. Keep the comments coming. Bill at thisweekinhealthit.com. Good, bad, or indifferent, it all helps. You know, the person who sent me the comments saying, hey, you're too monotone, I'm working on it. So just keep them coming. Let me know. The people who tell me, hey, you go over 20 minutes every week, I'm working on it. So I appreciate the comments. So this show is a production of This Week in Health IT. For more great content, you can check out the website at thisweekinhealthit.com. Actually, it's thisweekhealth.com. We've shortened it up. You can still get there by going to thisweekinhealthit.com or the YouTube channel at thisweekinhealthit.com/video. Thanks for listening. That's all for now.